Okay, I'm Lydia Grubb, and I will be one of your Med-Surg 2 instructors. And so we decided to film IV starting and the use of pumps and tubings and bags. Do this on a film so you can watch it anytime you want to. And so, of course, first thing I'm going to do is wash my hands or use the disinfectant. And I always start out by saying, I have nursed for 46 years, and I think my way's right. But there are other ways that are right too, and they're legal. And so I'm going to show you my favorite way after 46 years. But I want you to understand, your instructors may have a little different way, and theirs is if it's legal and safe, and which it will be, or they wouldn't be here. Listen to them, see how they do it, and then when you graduate, you can pick one little something from this one and a little something from that one. We all are teaching basically the same thread, but we just do it a little bit different. So keep that in mind. My way is not the only way, but it's one way. And I always start with my first lesson. Maybe you got it in Fundamentals in Med-Surg 1. But so that I don't spend a lot of time at the bedside while you dig out this alcohol, there's a way to open it that I don't have to stand and wait on you, and that's in the middle of the package. You pop it and see how it pops up, then you can just take it out. Now that's my first lesson, and it's not a hard one. And maybe you already know it, just do it. And then I think we're ready for the hanging of an IV bag and tubing. There's been an order, and I can't stress with you enough to go back and review your types of IV bags. And so they're also in your briefs, your clinical decision-making briefs, the different ones. Dextrose, D5W, that's 5% dextrose in water, and so it's D5W. We have, and you can go down the list, remember them from, I think you learned them in Med-Surg 1. We'll review them again, because sometimes the instructors have been known to hand you the wrong one, and you just trust them, and you go in to hang it, and you didn't check what type of IV fluid it is. We have then D5 lactated ringers. That's 5% dextrose with lactated ringers, which have a lot of electrolytes and things that the patient may need. We have 1/2 saline, which is 0.45. You know normal saline is 0.9. The bag will say 0.9%. And that's normal, 0.9. That isn't even 1% of salt. So half normal saline is 0.45. So if you're given a bag of 1/2 saline, it's 0.45. A fourth is 0.225. Just review this, but I want to run by it. So if your order said D5 1/4, then you would go to the supply room and get D5 0.225. So I think I've belabored that enough. Now, you read your order. We know exactly what we want to hang. This is D5W. And please notice it's already slit. There's a little place for you to pull it. You don't have to struggle and fight with it. You find your little slit, you open, and you remove the battery. And then hang it up. And then, while you're up there, why don't you go on and pull the covering that is, and see, it doesn't blow out until you spike the bag with something sharp. And some people think that it's going to pour out. It doesn't. And then I want you to label that bag and if you have, some floors have labeling for the time we put it up. You put a label on here, the time that you're. So here is a piece of tape. Some of the floors you can use any kind of tape, some of them, whatever. Just put it on and let's put the whole date, 5 or 6, 21, 14, and the time is 10:30. And just be sure you don't, some nurses will use their Sharpie to write on the bag and not on a piece of tape. And the word is that it will leach through, the magic marker or Sharpie will leach through to the sterile solution. So always use a piece of tape, even though you may follow a nurse who's used the Sharpie on the bag. So this bag is good for 24 hours, and you need to know that, because every morning you need to check your bag and make sure, when do you need to change it? Well, if you came on tomorrow morning, you know, and you still have this bag, it needs to be changed by 10:30 tomorrow morning. Okay, so then get your tubing. And again, note, this tubing doesn't have a slit, so you pretty much do have to fight. So take your bag, again it has a spot, tear here, open it, so it's perforated so you're not struggling and fighting with the tubing. Then take it first thing, now watch my lips, first thing, clamp. As soon as I opened it, take the big clamp, the biggest clamp is best, and clamp it. And you'll see why in just a minute. This is attached to most of the tubing in case it's used without a pump. You don't particularly need it, so you can toss that. So you opened your bag, you clamped. Now you're ready to spike your bag. And because you clamped, when you spike, it won't fly, the fluid will not fly through. And that's been the problem. That's the reason I want you to clamp it, because if you didn't clamp it and you spiked, the fluid pours out all down and it's full of air fluid. We've already pulled the tag there. I want you to take the cap off the tubing and you're ready to spike. Put all caps in your pocket or the waste can, because they end up on top of your pump or in the bed, and then tomorrow morning it's made and the patient has impressions of all the caps that fell in the bed. So just put them in your pocket. Hold the stem of the bag, because you can't very well do this. And you don't want to turn it up like this, because then you'll spike the bag itself. Hold it straight up and down, and then kind of saw it, twist it in. I'm going to have to. And you twist it until you get fluid. And see, I hadn't got fluid, so I haven't quite punctured it well enough. Now, always have a little reservoir of fluid. And the reason is, if I don't have that reservoir, and I will get air, fluid, I'll show you. I'm going on it. Take it, here's the clamp that we clamped to keep it. See, it's not moving. We squeezed it and got some. That's enough, just a little reservoir solid, so that when we do run the fluid through, it's going to be a straight fluid through the tube, instead of, if you had not clamped it, it would just be fluid, air. Now, here's where I say, be dignified. Do it with dignity. Probably your dominant hand is the one you want to work the clamp. But take this non-dominant, and you don't even have to take the cap off the end of this. People find a waste can and get over it. I want you to be so good you don't need a waste can, but if you need one, okay. But I don't want you to lose a lot of fluid. So what you do is have your fingernail ready down at the tip end of the tubing. And notice now, I'm going to unclamp. Now I want you to watch the fluid when I unclamp. I'm going to unclamp, and can you see the fluid is pouring out? And I'm watching it. And when it comes down to the end, see it's coming down. I clamp with my fingernail. I got a few drops on. And then clamp with this. See, it's not pouring out. I clamped when it came here, I clamped with my fingernail and then clamped the big clamp, and we're good now. And it's not poured out. It's a solid fluid stream, not full of air, fluid. Now it's ready to attach to a patient's IV. And we're going to go over that in a minute. I want to stop to say three things here. All tubing has this little attachment, or part of it. And what it is a vent. And you open it or close it. See? Now the idea is that this tubing can be used with a bag or a bottle. In a bag, here's what happens. I spike. Gravity out here is pushing on this bag, so it doesn't need any air. We've got gravity pushing it through. If I put this in the patient and undid the big clamp, it would flow because gravity is pushing on the bag. But if I had a bottle of IV fluid, gravity cannot push it, and I need some help out from outside. So I open the vent, air goes in there and pushes the fluid through. So you open, if you have a bottle of fluid, you keep it closed if it's a bag. Now, that I wanted to point out. The next thing I want to point out is the disc on the tube. This disc does not allow any fluid to go back up into the bag. So if we were going to IV push, and I'll show you that later, right at this area right here, don't worry, no IV medicine's going to go up in the bag because of that white disc. And then, as we're coming down the tubing, here is the port that I hadn't even attached yet, but I can, if I wanted to give medicine through this port, you notice, I want you to see it good, and that little blue inside is a spring. See how, I don't know whether you can see how I can push on it. And you don't use a needle. We'll say there's medicine in this syringe. And I need to give the patient medicine. Then I twist, I of course wipe it, excuse me. I wipe it for 15 seconds. Now put the alcohol over it. Make sure your thumb is also doing the top. Don't just get it and wipe the sides, because what's going in is the top. So you do, and make sure for 15 seconds, I clean that. And then I put the syringe on top. And you have to push because it's a spring. Twist and give my IV push. And I'm just going to tell you right now, for most medications, you're okay to give it a half a milliliter over a minute, unless your references tell you to give it faster or slower. But if you don't know and you've got to give an IV push, you do a half a milliliter over a minute. So you're just pushing. Did I clamp anything? This IV would be running and it's taking the fluid with it. So I wanted to bring that up. Now, let's attach it. That was just to show you. If the IV is not central, I'm going to discuss central lines at another time, but a central line goes in the superior vena cava. So if this patient has a peripheral IV, of which you will start yourself, then I don't need gloves to attach. I do need gloves anytime I'm handling a central line. So I want to get my alcohol, and I want to wipe, recognize the port, and see that has no attachment. I'm getting ready to attach. And I go 15 seconds. And now I take the cap off, and of course you know where I'm going to put the cap. Uh-oh. That was what that was. Here we are. I'm going to make sure. Attach it. Now, do you see how that does? I want it as a unit. I want you to hold it that way, push, because see that's a spring, and twist. Now it's in place. Why am I particular? I don't want you to do this. Put that in, and then lock it. One thing, it's the manipulation's a little harder, but the other is sometimes when you put it in and then lock it, it gets a little bit of a twist, and the IV won't run, and nobody knows why it's not running, and it's because some way or other it didn't go in quite straight. It will always go straight if you'll do it as a unit, I call it, as a unit. While I'm on that, this is a peripheral IV that has been started and we attached. If this patient just keeps this part of their IV and we hook up to, say, give an antibiotic or periodically, it's called a saline lock because saline stays in there, and you just attach to give your antibiotic. And then when the antibiotic's through and it's flushed, you would take it back out, and see that is not covered. And then you just leave it. Of course, we'll wipe it when we reattach. Please do not take this end of the tubing and just drape it, flubbing in the breeze. It needs to be recapped. So you'll have a cap in your pocket and go on and put a cap on the end, because it's not sterile if it's flubbing in the breeze. Everything you take apart, never leave it open. Put a cap on it. Now, one thing I do want to emphasize is the saline lock. Some people call them heparin locks because we used to put heparin in the peripherals. This is the peripheral, this is central lines. We used to do heparin, so you may hear it called hep lock, but mostly it's called saline lock. And I've already told you, we take it apart, push the pump away, I'm ready to hang my antibiotic again. I come and go through the procedure I just showed you, and we're going to talk about starting the pump in a minute. But some nurses take it apart, and because they didn't bring a cap, and they know better than to let it dangle, here's what they do. They take it and put it into the port where you did IV pushing. They do this. Oh, it's covered, it's protected. Can't stand it. Your instructors can't stand it either. Why? It's covered. Because it's really questionable if the nurse who forgot to bring the cap stood there and took 15 seconds to put this back into there. But more than that, it's opening that line over and over by pushing in. So don't bring it back. You'll see nurses have done it, and I just want you to note it and be sad about it. But don't you do it. So now let me put that back. And there. Now, the order reads 100 milliliters an hour. And we have a peripheral IV. You've seen that. So let me attach him. He's not saline locked. He's not heparin locked. I'm going to attach him. So I take the cap off. Of course, I take an alcohol. And I'm going to wipe for 15 seconds. And then attach as one unit. Push and twist. Now make sure every clamp, you see the clamps? They're open. Make sure the clamps are open, not clamped. So make sure they're open. And I'm ready to put the tubing into the pump. So take, the company says start and just bring, this is where you're going to bring it down like that. Do you see this little part? It's going to go in a shelf, blue to blue. It can't go that way. You can play with it. And it goes in like a shelf. Now this is real important, that you take the tubing and push into a little V. It's a V. If you don't, you can close the door, but that little V shows air. And if you don't have that tubing in the V sees air. And it beeps and beeps and beeps, and you say, well, everything looks great. I don't understand. Well, it's not good and into that V. So push it in there. Close your door and realize that you're open. And so turn the machine on. Now, this you may need to practice some. So if you don't get it as I'm telling it, we'll be practicing, or you can, have time to work on it yourself. And it says new patient. It'll go through some exercises, and I'm going to put no or yes. It doesn't matter. We just keep going. Med-surg, yes. You can just, all that in the important part. The important part is the fluid situation. And so I want you to realize you always, wherever the tubing is, and my pet peeve, one of them, is that I like the bag over the pump that is. See, there's no pump. You can have a pump here, a couple of pumps. This is the actual pump part. This is the main part of your pump, but this is guiding this IV tubing, IV. So I go in, and I need to get this going at 100 an hour. Always tell the main pump which of these you're using. And so it tells you, select my channel. This is my channel, and I push that one. And now it says basic infusion. Yes, it's going to be a basic infusion. Primary infusion, rate and volume to be infused. The order, I just looked at my order, it said 100 an hour. So I come over here and push rate, came up, 100. Now I've got to clear some. 100. Now by volume to be infused, do you hear those words? Volume to be infused. That's your bag. The volume to be infused. And this is 500. Don't make it 500 or it'll go dry. The little V reads that you've got air in the tubing. We've already got air in the tubing, and to get it out is not quite a thing to do. We'll talk about it another time. So I want to do less than 500. Always the main bag do less. Let's make it 100 less. So it's 500 bag. I'm going to do 400. Uh-oh, I did 4,400. Just clear it and go 400. And so I've got my rate, my volume to be infused, and now I start it. Now, I know it's running because, well, it isn't. Do you see, I want a green light. I've got a yellow. I don't know whether you can see it. Now, do you see checking line? Well, look, we're still clamped. So that's why it doesn't like it. Soon as I unclamp, a green light. You want the green light. It says 100 rate, milliliters an hour. Over here, this is your volume to be infused. Now it's $3.99. And see, it's just running now at 100. It's exactly what I asked it to do. 100 an hour. I know it's running, but see, now let's watch it again. When there's anything wrong, it's not in the patient good. The IV's not, see what happened? My green light went out and a yellow light, and it said check. And if we'll wait just a second, it'll probably say clamped or occluded or check line. Just wait a second, I think it will. Yeah, see, occluded and a red light. Now, the minute I unclamp, I realize it was clamped. You can restart, or sometimes it does on its own. Restart, I restart it. So far, you've been with me for channel select, and then we did primary rate, primary volume to be infused. Now, some more buttons that we'll want to know about are silence, and then we'll talk about some more in a minute. Restart. Okay, this is great. Patient's going at 100 an hour. Oh, I was told to check my orders that I have a piggyback, an antibiotic to hang. And so it comes up, yes, it's the right Capsol or whatever my antibiotic is. I check my order. And sometimes the bags will tell you how fast to do them. Sometimes they won't. Some of the HCA hospitals, the pumps are programmed for a particular antibiotic. For St. Thomas and some of the others, you have to plug in how fast you want your antibiotic to go. How do I know? Well, it may be on there, or I may have to look it up. The MAR, the electronic MAR, may tell you how fast to give this antibiotic. So, my antibiotic came. It's Ansep, we'll say. So I checked it. I checked my order. I hang it. While I'd hung it, I might as well pull my tag. Now just pull that. Of course, that goes. Now I find my secondary tubing. And it should say secondary medication set or secondary tubing. Again, don't fight it. It's usually perforated or there's a slit. Look for that before you go struggling and fighting. What did you do before? Okay. So I opened the bag, and what do you remember? Now all this came in the bag. What was the first thing I did with my big tubing? And that was clamp. Don't say a word to anybody, clamp. It's so important because I hadn't got a lot of IV piggyback antibiotic, and if I spike it and hadn't clamped, by the time I realize it, half the bag's gone because I didn't clamp it. So anytime, open your bag, clamp. I have two other things that came in that bag of secondary. One is a hanger, and the hanger comes not for your secondary. Do you see this secondary tubing so much shorter? The hanger comes for the primary bag. And so I'm going to go on and get rid of my hanger. So I want the heavier bag to be lower than the piggyback because the weight of this small amount is not enough for the pump to handle. It has to be lower. And that's just a physics thing that I've already told you more than I understand. So, here's my piggyback. I'm clamped. I take the cap off, and you know where I put it, in my pocket. And then I hold the neck again, and so I'm going to notice, this is a big thing with me, I don't want you to take the cap off and then come up here and try to get this, because look what I'm doing, contaminating. Keep the cap on till I uncover where I'm going to place it. So, I take the cap off now, twist, squeeze, I get a reservoir, little reservoir, that's wonderful. Now, do you remember on the large tubing that I held it with dignity and unclamped and clamped with my fingernail and then clamped, remember? You can do it that way and there's nothing wrong with it. But I don't want to do it. I have reasons and I'll tell you why I don't do it that way. It's perfectly fine. But I'm going to put my dry tubing into the port of the main bag. And do you see it's above the pump? Well, I got to get an alcohol and wipe my port 15 seconds. Because I don't know. Okay. Take the cap off, but you probably need to keep telling yourself, dry tubing. So we wiped good, 15 seconds, cap in the pocket, just took it off. Remember, I want it as a unit. You have to push and twist. Now, say to yourself, dry tubing, because the little V in here will catch your air. You've got a whole tubing of air that could go, but it's going to catch it. But the point is, you have air in your main tubing now, and it's just difficult to get out. And I'll go over that in just a minute, should it happen. Because I've got all this air, I'm going to take my bag and lower my piggyback bag, lower it, still the clamp's on. Notice the clamp's still on. Lower it and then unclamp. It's got to be lower than the main bag and it's got to be upright. You can't do this. Do it upright. Unclamp, and I want you to see that it'll back up. See the bubbles coming? That's air from the tube there, that dry tube. When the level starts coming up, did you see the level coming up? When the level starts coming up, don't clamp it back, just raise it back up. Now I want to go over a little bit of that again. Let's say I'm talking to the fan. Oh, it got so high. I need to see the drip, but it's so high. It's full because I was visiting. When that level started coming up without bubbles, just raise it up and it stops. But if you do, let me show you. Now you can do this, turn it upside down, put the medicine back in the bag. But when you do that, you get an air pocket. And that air pocket, you're going to need to lower. See how it came out again? I don't know whether you saw it. Now, let me tell you. Okay, I'm ready, and I raise it up, and it quit. But some people do this. Start clamping it back. Well, the trouble is it keeps coming up, and it may get too high while I'm trying to clamp it back. Oh, it's too high. Nothing wrong with turning it upside down and pushing the medicine back in. But you got to get the air pocket out. See if you can see the bubble come back up. That one didn't have a bubble, did it? Okay, so let's go through it again. When you lower and you get a reservoir without bubbles, raise it up rather than clamp. And the bubbles here, I don't even want you to watch. It's only the bubbles here. Because, see, all the air's out of the tubing, but you see the bubbles are still coming because it's still got air there, but we don't mind. It's air in the tubing. Too high, turn it up, push the medicine back in, drop it, and see, sometimes you'll see, you may or may not get air. That time it didn't, but don't worry about bubbles here, only here. And see, a level's coming up without bubbles. Raise it up. It stops. I'm ready to hang it. I like to hang it all above the pump we're using. I'm going to check my order. And the order just said, give ANSEF Q6 hours. So pharmacy put it on a 12-6, 12-6 time of day. So it's noon, we'll say. And I'm ready to give this. And either the bag says it, the pump has been pre-programmed, or the MAR has told me how fast to do this. And so I'm going to give it over this, I'm going to see, this bag is 50 milliliters, and I see that they want this in an hour. So, a gram or whatever. I always remember, whatever I do, I have to tell which pump I'm using. And I'm using, or channel, I'm using this one. And the primary is running. But can you see down here secondary? I need to push secondary. Now, it has some medicines listed, and at HCA, you're allowed to just push those medicines. At St. Thomas West, we have to go basic. And now it comes up secondary, and it wants us to put the rate and volume to be infused of the secondary. Our rate, because it's milliliters an hour, it's to go 100 milliliters an hour. The gram goes in an hour. Our rate would be 100, you have to put rate, 100. Volume to be infused, this one I want dry. It's 50 milliliters. I'm going to make it 50 or 55 or even 60. So I think I'll do 55. We want it cleaned out. You say, well, what if tubing gets air? That's all right, because the next time I hang it, remember what I'm going to do? Bring it down and lower it to get the air out. The tubing, okay, so let me start there. So I started, and it automatically, don't leave the bedside till you see the word secondary, and is it dripping? Can you see it dripping? Those two things, secondary, is it dripping? And if it isn't dripping, it won't beep at you. You remember this, the main pump beeped at us when it was clamped? Well, if you happen to leave this secondary tubing clamped, it just takes it from the main bag at the rate you said. And so it may say secondary, but unless you look up and see it dripping, it's just taking it from here. So there'll be no beeping if secondary is clamped. That's the reason you must see secondary and you must see the drip. It's fine. It's going to run in an hour, and I don't have to come check. I can if I want to, but it automatically will go back and start giving the 100 an hour of the main bag. One other thing, I told you that bags, main bags, are 24 hours. Tubing is 3 to 4 days, depending on your hospital. So today happens to be a Wednesday. Thursday makes one day, Friday makes another day, Saturday makes another day, Sunday it needs to be changed. So I'll write change 5/24, whatever 4 days are. Today's the 21st, it'll be like the 25th, 14th. I put on this the date it's to be changed, so that when an assessment's done, people check when the new bag needs to get hung, and of course you know why, for germs. And the same with tubing. 3 to 4 days, whatever your hospital requires, but go on and put a tag on. Now let me tell you, you may be at one of the areas in your hospital that do not do this with vengeance. And for instance, one of my floors at St. Thomas West doesn't do it that much because the turnover is so fast. Pre-op, post-op, they're in, they're out. Nobody dare stays 4 days and hardly 24 hours. So they're not big on doing this. My particular floor is oncology, and it's real important that germs don't grow. So we're real prudent about bags. Another floor may be. So you just kind of have to see. But know this is the good thing to do. So the secondary's running. Now, let's say it's through. The secondary's through. The main bag's running. It's 6 hours later. and I need to hang another piggyback because that order was every 6 hours. So I take my new bag in, and if it's a different antibiotic, see if it's compatible with your NSAID, because we don't need, if they're on 3 antibiotics, 3 apparatuses, 3 sections of tubing and bag for each one. Check and see if it's compatible, and we can use the same tubing with this next antibiotic, which is another type. And so check and see if it works. It looks like it's going to work. That bag, for practical purposes, it's empty now. It was empty an hour after we hung it. It's now 5 hours after it's empty. I'm ready to go in and hang another one. This NSAID, we hung at noon. It was through in an hour. It's empty now. And the fluid, oh, see, it went kind of dry. That's fine. No problem. Do you see the air in the tubing? That's no problem. We're going to back it up, remember? On compatibility, if this is empty, it's not as needful for you to check compatibility if this chamber's empty, because you can backflow the saline or the D5W. Now, it's 5 hours after this is through. It's noon, or it's 6 o'clock in the afternoon, and the next IV piggyback is ready to be hung. Doesn't matter what it is. We just know this one's going to be $50 an hour. That's what I found out from the MAR, or on it, or HCA says it. Now, this is so important. You walk in the room, and don't even speak to the patient. No, that's an exaggeration. But dive for this clamp. Because, and I'll tell you why, come in here and clamp it. Because see, it was open to let it go in, and then it switched over to here, and it's still open. So I need to clamp it for the same reason I always need to clamp tubing. I'm going to take this down, and if I hadn't clamped it, and I bring it below the main bag, you know what's happening. If it's open, it's filling up with IV fluid in the bag I'm ready to throw away. So I've clamped it. Doing that, I can just put it there, hang the piggyback bag, pull, ready to put it in your pocket. Now take the old bag. You see, remember, I wanted you to do that so you're not trying to pull it off with this spike, sterile spike in the air. Hold your neck, twist, squeeze to get a little reservoir. And now, remember, we lower than the main bag, unclamp, and watch the bubbles coming up. When the bubbles quit and the level, now see, it's a little full, a little too full for me to watch the drip. I need to see the drip. So, you know what I do. Just turn it upside down. But I'm getting an air pocket when I do that. Push as much in there. Flip it over. Lower it. You see how it's coming, but no bubbles are there. Then raise it. As long as there are no bubbles and the level's coming up, just raise it up, and that stops it, rather than the clamp. Because by the time you get the clamp clamped, it's full again. So that's now, you know the routine now, the channel, okay? The pump you're using, see, it's still primary. Go to secondary, and at this hospital west, St. Thomas, it goes to basic. Secondary rate. All right, you see milliliters an hour. It asks for 50 milliliters an hour. So my rate is 50, and my volume to be infused is 50, but I'm going to make it 60. A minute ago I made it 55. I told you it could be 55 or 60. I'll make it 60 this time. If it runs dry, it just runs dry in the tubing, and you saw what we did. We just back ran it. Now, secondary, is it dripping? Secondary, is it dripping? If it isn't dripping, do not leave the room until you see it dripping, because you may have clamped that. Now, this is probably a good time while that antibiotic's running. All right, so we just hung that piggyback, but we noticed the main line is getting low. 50 milliliters or less, we need to change this bag. You don't want it to get away from you, meaning go dry, because when air gets in this tubing, it's hard to get it out. I've spoken about that 2 or 3 times, so let me talk to you just a minute about getting air out of that tubing. What you have to do is, let me just show you. You go on and clamp the tubing, open the door, bring the tubing out. When you open the door, it clamped. That made a clamp. Do you see what I'm doing now? It unclamps. Pushing that. So it's unclamped now, but this is clamped. Now I've got, let's say air is in the tubing, because I got busy and the bag went dry, and air has now gone until, it doesn't beep at you, till it meets that V that we talked about. So I've gotten air in the tubing because it keeps saying air in the tubing. So I will clamp the big clamp, because I'm going to open the door, and when I pull the tubing out, it is clamped. The door pulled that part out. Now, to unclamp it, and I'm fine because remember I'm clamped here. To unclamp here, you just push it together. It takes some power. See how I did it? Okay, now I've unclamped that. I've opened this. This is in the patient, but I don't want to, so I've got air. I find my first port, which is right down here, the first port, and I need to clamp. If you have your hemostats from your pack, clamp behind the port. Take your alcohol, wipe for 15 seconds, put an empty syringe, and aspirate fluid and air. So I'm open, I'm clamped below my port, and I now, I'm sorry, take the empty syringe, put it in the port, aspirate fluid and air, fluid and air, fluid and air. But I'm clamped below the port so air will not flow past here into the patient. Now let's get this straight, it's not going to kill the patient. Movies and novels have scared everybody to death, but I keep pulling air and fluid, air and fluid. Then once I'm getting nothing but fluid, I take it off, unclamp, and I go back and put it in the machine. Okay, now I'm going to put it back in the machine because all the air's out of it. Remember, with the little shelf. Do you see? It's open. And when I put it in, and put it through the V, let's go through in the door again. Open. You see how it now is clamped. I unclamp it, I'm still clamped. Just push it in, the V, close the door, unclamp, and we're in business. Restart. Now that's just getting air out. Your instructor would not expect you to do that by yourself. You'll be doing it with your instructor. What about taking it apart at the patient and running the fluid through to the waste can? Well, I don't like that so much. Some people do it, and I've done it in my day if I have to. But I'd rather you aspirate and we not open the line. All right. I told you this is getting low. I need to change the bag. Now remember when I was changing, I need to bring this up again. When my piggyback was running, when it finished and I came back in, do you remember the first thing I did when I entered the room was clamp the piggyback so that I could bring it down and it wouldn't fill up. Okay, so what I do with mainline is a little bit. Check your bag to see if it is the right solution. Find your slit and open. I want to say this, if you're at St. Thomas West, when you get these solutions, they have these tags on them. The white tag is taken off and put on a card in the supply room. Do not take the pink tag. It gives them credit. It credits them the bag, doesn't charge the bag. That happens just to be unique for St. Thomas West, but remember, pink is the credit one. We've got to charge. You pull that off and put it on a card in the supply room. Here's my new solution. And so, here's the rules I want you to remember on mainline. You take it off the hook or the whatever, and always hold it upright. In other words, I can wad it up. I can do anything as long as I keep it upright. The reason being, the minute I tilt it or try to take this off, I get an air pocket. Well, a minute ago, I got that with that. Yes, and I could lower and get the air out. But I cannot lower the main bag. It was the main bag that helped get the air out of the piggyback. Main bag doesn't have a main bag. So my goal is to never turn this upside down. To do that, I just keep it upright. I work. All I need to do, I just keep it upright. So I hang the main bag up. And notice I'm coming down. Still, this is upright. And I hold and pull. Pull it, goes in your pocket. Again, this is all upright. I can do anything I want to, keeping it upright. Now I'm ready to spike my main bag. I need to, of course, put a tag on it. But take it and flip it away from you with the channel still upright. Take it off. Do whatever you want to with it. Hold it. Put it up here. Do whatever. But always upright. Now, twist it in. And if you don't have any air, you're ready to go again. Go on and put you a new piece of tape on with the date and time. Okay. Now, toss the bag. The secondary is still running. It'll come back to the main bag.